So this is the video of the lower third molar surgery or the wisdom tooth removal surgery. It is done under anesthesia, and the anesthesia given, the technique is used is inferior alveolar nerve block, which anesthetizes inferior alveolar nerve block, the main trunk. At the same time, we use the lingual nerve block and long buccal nerve block, which anesthetizes the surrounding area. The anesthesia use is profound, and the clinician is aware about the technique. At the same time, the amount of anesthesia to be deposited so that the patient does not have any pain sensations during the procedure. However, I would like to point out that the patient will feel sensations like pressure but no sensations like pain. Once the anesthesia is given, we use the periosteal elevator to reflect the flap or the gums from the bone. Now what is done here is, it is a non-surgical extraction to start with. What we are doing here is we are using the periosteal elevator to raise the gums, to remove the gums which are adherent to the bone, and that way we will get more access to the bone and the tooth, and thereby we can create a purchase point which we will use as a lever. So basically a lever principle is used and a wheel and axle principle may be used when it comes to extractions. So in extractions we use specialized oral surgical instruments known as elevators. As the name suggests, they help in elevating the teeth, and they use either the lever principle or the wheel and axle principle. Basically the technique that is used is not much boastful about the power. People have this misnomer or this misconception about oral surgical procedures or wisdom tooth surgeries, that it takes a lot of tremendous energy and brute force to take out a tooth. However, let me remind you that taking out a tooth is very technical and it is very harmonious. It's very slender motions done by the oral surgical who has been trained in this, and as you can see, with just the slight pop of the elevator, the tooth comes out and it has come out in toto. As you can see in the following scenes, that the tooth has been taken out and it is come out completely, and hence after this we will make sure that the socket which was previously infected is irrigated with medicines. We have used betadine in this case so that all the microbial load that is present because of the infection is actually reduced because of the irrigation. Finally, depending upon case to case, if the wound or the extraction socket is very gaping, it is deep, or there is a propensity for food collection to be there, we decide to give sutures. Now sutures are of two types, that means the stitches are of two types. The first one is non-resorbable sutures that are being given right now by the oral surgeon. These mean that the non-resorbable nature of the suture means that they will not slough away on their own. When you use resorbable sutures, they will slough away on their own, and that means that the body will eat away those sutures and they will dissolve, and thereby that reduces the appointment numbers. However, this choice depends on the case selection, at the same time the perspective of the clinician who is operating on. In such a case, we know that the patient is planning to come back for suture removal and the nature of the extraction socket is actually kind of big. Thereby we are giving multiple sutures so that we can close off the wound. Hence, once the patient goes back to their house or their home, basically there's less of chances of food lodgement or any post-operative infection or any sort of post-operative swelling. Now, as you can appreciate, we have finally taken the last suture, and you can appreciate how the extraction socket margins have opposed, that means joined together very nicely, and you cannot see any gaping of the wound or the extraction socket. This thereby ensures that there will be less of food collection and less chances of infection because of bacterial contamination in the extraction wound area. As you can see, we are giving the final knot, and thereby we will make sure that we take the suture scissors, the suture cutting scissors, and finally make sure after irrigation is done, we have pulled to check all the areas that every margin of the extraction wound is closed off. We will finally make sure that everything else is all right, and we will finally tie the knots, and finally we will cut the suture.